Hi, I'm your host, Marsha Florence with Just Ask. Today our show is Medicare and You. Hurry back and join us. Hi, I'm your host, Marsha Florence with Just Ask. Today our show is Medicare and You, and our guest is Fran Plex, Assistant Manager for Medicare Outreach. Hi, Fran.
Hi, Marsha.
Thank you for coming.
Oh, my pleasure.
Thank you. Now, Fran, the title of Medicare Outreach seems kind of strange to us, but we know what Medicare is. So why don't you start off with telling us a little bit about yourself and the organization that you represent?
Okay, Marsha. Again, I am the Assistant Manager for Medicare Outreach with Wisconsin Physicians Service, or WPS. We are the Medicare contractor for administering Medicare Part B in the states of Michigan, Illinois, Wisconsin, and Minnesota.
Okay, now when you say Wisconsin Physicians, that must be the hub for this particular program.
Yes. Our main offices are in Madison, Wisconsin, but we do have offices here in Detroit, Michigan, in Illinois, in Chicago, in Marion, in Madison, Wisconsin, and then in Bloomington, Minnesota.
Okay. And exactly what does your organization do?
Our organization is charged with administering the Medicare program, which means we pay claims. We pay Part B claims, which means if your viewers have had a Medicare Part B service, the claims will be submitted to our offices. We process them. We send the payments out. We also respond to inquiries, both telephone and written, Marsha.
Okay. Now, when you say Part B, it must be a two-part. So what is Part A and Part B of the Medicare program?
Okay, there are two parts to Medicare, Medicare Part A and Medicare Part B. Medicare Part A, Marsha, is generally hospital insurance, and that means that beneficiaries who are in the hospital or who receive services in a facility, like a nursing home, will have their coverage or their benefits provided by the Part A portion of Medicare. So, for example, if a beneficiary is in the hospital, their room and board, the nursing care, the meals would be supplied by Part A.
Okay.
Now, Part B takes care of professional services or medical services. So that for the same example, the Medicare beneficiary who's in the hospital would have the professional services such as the anesthesiologist if there is surgery needed, or the care of the physician would be covered under Part B. Also covered under that, Marsha, are things like office visits, flu shots, those types of benefits.
Okay. Who's eligible for Medicare?
Medicare is generally offered to people over the age of 65, generally people who have worked enough credits, Marsha, into the system. They've paid enough Medicare taxes into the system that at the age of 65, the Social Security office would contact them, let them know they're becoming eligible for Medicare. The Medicare program also covers some people who are disabled and people who are on end-stage renal disease.
Okay. What is, and I know our viewing audience are asking this question, so I thought I'd help them out. What is the difference between Medicare and Medicaid?
That's a good question, Marsha,
Okay.
and that is very often a confused concept between the two. Medicaid is a state and federally funded program that helps pay for health care costs for people with low incomes and other special situations.
Okay. Because I think a lot of times when you hear people say, I've got Medicare, or no, we'll go back up. When I've got Medicaid, that the assumption is that's the young person or single parent with children's services through social services, and Medicare is for the elderly.
Generally, that's the concept, Marsha, yes.
Okay. But actually, a person with a disability is eligible for both or one?
A person with a disability could be eligible for both Medicare and Medicaid.
Okay. And you can carry both of them at the same time?
Yes, you can have Medicare and Medicaid at the same time.
Okay, that's a good one. Now, what is it Medigap insurance?
Medigap?
Medigap.
Okay, there's Medigap and supplemental. But first, Marcia, let's talk about, again, Medicare covers all of the things that I talked about, and that certainly wasn't an all-inclusive list. Okay. But Medicare was not designed to pay for everything. There are deductibles and coinsurances, pretty much like you and I know through our automobile insurance and our own health care insurance. So there are deductibles and coinsurances for both Medicare Part A and Part B under the program that can be picked up by either a Medigap or a supplemental insurance. And generally those two concepts are for people who have a health plan insurance through an employer group, or who people who purchase a health care plan that supplements what Medicare doesn't pay.
Okay. Now, after a client sees a health provider, who files the claim?
Oh, that's a good question, Marcia. For anyone who receives a Medicare service under Part B, the physician is required to bill the Medicare program, which is through WPS. They do have the option, though, of either accepting assignment on a claim or not accepting assignment on a claim, in which case, if they accept assignment on a claim, the price of the procedure would then be sent directly to the provider.
Okay.
Or in some instances, the beneficiary may receive the payment.
So if a bill is processed through your agency and there's a balance left over, who actually gets that balance?
Every Medicare beneficiary that has a Medicare service receives a Medicare summary notice, whether it's Medicare Part A or Medicare Part B. That Medicare summary notice, Marcia, lets them know that we've received a claim for that individual, what's the date of service, where the service was performed, and how much the charge is for that particular service. It will also indicate what Medicare's payment is. Now, generally, under Medicare Part B, we will pay 80% of the approved amount. Therefore, the beneficiary is responsible then for the 20% or the copay. There's also a $100 deductible that must be met under Part B as well. Okay. But that Medicare summary notice pretty much lets them know what they will be responsible for. And also, Marcia, if they do have a Medigap or supplemental insurance, and we are forwarding that claim information to that other entity, it will be noted on the Medicare summary notice.
Okay. But when you say it's like a balance left over, this person may be of a low income nature or fixed income, and here comes a bill for the difference of a hospital stay. And probably there's no way that they can actually pay this bill. Is there a penalty if you don't pay the bill, even though Medicare has paid their portion? Is it something to fall back on to a claimant if they should not pay the bill?
Well, generally there are other services that are available, such as Medicaid, that may provide assistance for the beneficiary that will help pay for some of those leftover medical costs. But generally the beneficiary is, held liable for those co-payments and those deductibles under both programs.
But is Medicare the primary payer?
Medicare is often the primary payer, but there are certain situations, Marcia, where Medicare would be secondary. And there are 8 provisions that the federal government has where Medicare is secondary. And just to mention a couple, if a beneficiary is injured in a car accident, the car insurance would be primarily responsible for that beneficiary's health care benefits. Now, we will coordinate that with the insurance company, but it's very important that when the beneficiary goes to the doctor or goes to a hospital for medical care resulting from an auto accident, that they advise their healthcare provider that they were in an accident and get all of the information as far as the auto insurance, because once Medicare is notified, we will put on their file that their benefits that they need to receive as a result of the injury related to the automobile accident should be primarily paid by that other insurance company.
Okay. So that could be a long, drawn-out battle.
It could be.
Okay.
It could be. But what's most important, Marcia, is that the beneficiary gives all the information to their healthcare provider, the whole situation. And that's just one of the provisions.
Now, if the beneficiary is not satisfied with a decision, can they file an appeal?
That's a good question, Marcia.
Okay.
Under Medicare Part A and Part B, there is an appeals process. Under Medicare Part B, Once we send out that Medicare summary notice, the beneficiary has 6 months from the date of that notice to notify us that they are unhappy with the decision that Medicare made, whether we pay too much or too little or made no payment at all. So then they would contact us. Then we would go ahead and begin an informal review, which is the first process of the appeal process, and then notify the beneficiary after we've made a review of that claim, and perhaps there may be other information that was not provided at the initial claim, so that the beneficiary, through their healthcare provider, can provide additional information that'll help us make a new determination.
Okay. Let me give an example here. If a situation takes place where a patient's in the hospital and they have Medicare, and somehow the administrators come to the bedside of a patient and says, well, we have to discharge you because your medical coverage has run out or, doesn't exist. Is there a program or appeal procedure where the claimant can call somebody right away, stop them from removing them from the hospital?
It's a great question, Marcia, because that sometimes does happen. Now, once a patient enters into the hospital will correspond with Medicare, provide all of the medical documentation as to the reason that they're in the hospital. They'll look at diagnosis, they'll look at treatment, they'll look at various procedures, and then they will provide information that will help us determine the medical necessity. Now, at that point, at some point during the hospital stay, Medicare may make the determination that they can no longer stay in the hospital or that we will no longer pay for that stay. The hospital would advise the beneficiary. At that point, the beneficiary or their caregivers, their loved ones, or anyone who's acting on behalf of that beneficiary can contact the Michigan Peer Review Organization. And the Michigan Peer Review Organization, or the PRO, as we refer to them, are charged with looking at the quality of care and also to look at situations where the beneficiaries are being asked to leave the hospital too soon, so that a call would be made to the Michigan Peer Review Organization, an appeal process would begin. The beneficiary is allowed to stay then in the hospital until that appeal process has been completed. And generally, Marcia, it's very, very quick.
Okay, but if you're in the hospital and you do this, you appeal this decision, you still can receive treatments and everything while this appeal process is taking place.
Generally, the hospital will continue to care for you, but at that point they may say, well, there's no other treatment that we can do. They will keep you there, but then the Michigan Peer Review Organization, through its medical personnel there, will determine whether the patient should indeed, leave the hospital and perhaps pursue medical care through an outpatient basis, or whether they should remain in the hospital and additional care be given.
Okay, that seems a little difficult because I don't think that patients know that they have that right. A lot of people may not know that they really can appeal a decision, make a phone call right quick and say, they're trying to put me out this hospital, I'm not ready, I don't feel physically fit or able to be removed from the hospital, I feel I need extended services. So I don't think a lot of people know that the appeal process is available to them, or the peer, I'm sorry, what's the title of it again?
It's the Michigan Peer Review Organization.
Peer Review. Is that located on the card somewhere? Does it tell you anywhere in particular in your brochures that you can...
We do have brochures, Marcia, and the Michigan Peer Review Organization also has an outreach program, just like Wisconsin Physician Services does. And they also go out to different senior centers and they attend different health expos or healthcare screenings, and they meet with beneficiaries to explain to them that these are their rights. And so we do have a lot of different types of brochures that your viewers can call and ask us for.
Okay, well, Fran, I'm going to have to go over that phone number with you and call them and ask them to come on our show and tell the general public what their rights are as people who have Medicare insurance as their primary.
It's a great program, Marcia, so it would certainly be of benefit to your viewers.
Okay. Well, let's take a commercial break and come back with some more good stuff.
I can listen.
I can cook.
Good. I can coach. Kids with something to do are less likely to do drugs.
I can drive.
I can paint.
I can dance.
A little of your time can make a lifetime of difference.
I can read.
I can help.
You can help. Call toll-free 1-877-KIDS-313 to find out about community drug prevention programs.
I can keep a kid off drugs.
Hi, and welcome back to the second half of the show. For those of you who are just now joining us, we have Medicare and You, and our guest is Fran Plex. So, Fran, now our viewers who are just tuning in to us probably saying, what is this? Okay, we've been talking about Medicare all morning, which is a great thing. I know that somebody want to know if they had questions in particular about some of the services or the overall agency in itself. Who would they call?
Okay, Marcia, first of all, if they have a question about their Part B service, they have a question about what was paid or had a question the reimbursement, they would call Wisconsin Physician Service, and we have a toll-free number, and it's 1-800-482-4045. And then they would contact the United Government Services if they have a question about their Part A claim. And generally, Marcia, these numbers are on their Medicare summary notice that they receive once a claim is processed. But we do have other organizations that provide assistance to Medicare beneficiaries, their advocates, and their caregivers.
Okay. Now, the Medicaid Part A, United Government Services, what is that?
Okay, United Government Services is the contractor that handles the Part A portion of the Medicare program here in Michigan.
Okay.
They do the same type of work that we do. They process Medicare claims for Part A, and then they also address inquiries.
Okay, so the client should basically know which services they have before they dial someone's number that they want to address. Okay, so we have a number here for United Government Services, 1-800-804-0686.
That's correct.
Okay, that's their number. Okay. I know somebody wants to know, do the Michigan Peer Review Organization have a number? And basically, they are, if a decision is made upon your release in the hospital, you should contact them. Is that what they do? And
they also monitor quality of care.
Okay.
It's a great organization. They do a lot of outreach presentations. And if your viewers are interested in having someone come out to do a presentation to their church or a senior center, the Michigan Peer Review Organization, I'm sure, would be happy to do that.
Okay. And they're at 1-800-365-5899.
That's correct.
Okay. We're going to put all these numbers on the screen, so even if I say them too fast, ladies and gentlemen, you can see them on the screen or give us a call here at Just Ask. Also, we have a number for... Now, we didn't ask the question. What is Medicare and Medicaid Assistance Program, MMAP?
Okay, we refer to them as the MAP program, the Medicare Medicaid Assistance Program, and they are a wonderful group of volunteers, Marcia, who work throughout the state of Michigan. So we have volunteers in the Upper Peninsula, we have volunteers in Southeast Michigan, we have volunteers everywhere. And they are highly trained professional volunteers that can address issues on Medicare and Medicaid. Now, the difference between Medicare and Medicaid, again, is a very sometimes confusing programs. The MAP folks, or the Medicare Medicaid Assistance Program, will meet with people on a one-on-one basis, Marcia, which is something, by the way, that's a very wonderful service because everyone's needs are very different, they're individual. And so someone can call the Medicare Medicaid Assistance Program through the toll-free number. A volunteer in their area will contact them, and if necessary, they'll sit down and meet with them, talk about Medicare. They're also a wonderful resource tool in helping folks who are interested in becoming eligible for Medicaid. They've worked with attorneys, they've worked with the Medicaid program. The paperwork is, just like with any insurance company, it's endless, and they can help you sort through that.
Okay. Sounds real good. Now, they have an 800 number, too. So, got all these 800 numbers, which is good because people don't want to know that they got to call 248-313-734, all these area codes, when actually a 1-800 number can pretty much answer all the questions.
That's correct.
So, for Medicare and Medicaid Assistance Program, that's 1-800 803-7174?
That's correct.
Okay.
And Marcia, they're also involved in a new program with long-term care. So that's another issue that is very similar to Medicare, but again, it's long-term care. And if your viewers have some questions about long-term care insurance, they should call very definitely the Medicare Medicaid Assistance Program.
Okay, good. Okay, so we're going to make sure we post all those phone numbers up. And now, do you have a website?
Yes.
Okay.
WPS does have a website. We are at www.wpsic.com. Now, that website, Marcia, will tell you all about our corporation. And then there's also then an opportunity for beneficiaries to look at Medicare information. Another website, another Medicare website it's a very useful tool, and it's through the federal government. It's www.medicare.gov.
Okay.
And that is through the federal government. It's a wonderful website, lots of information. There's even an opportunity to put in some personal information in terms of whether the beneficiary is looking for a managed care plan or any situation, and then specific information then is given to the beneficiary.
Okay, sounds great. Now we have some more than brochures, we have some books here. Choosing a Nursing Home. Okay, so what if we were to get this book, what will we find?
Marcia, this is a great resource tool for people who are interested in making a decision of whether they need to go into a nursing home, what situations there are out in the community, what to look for in a nursing home, and overall just how to choose a nursing home that fits your needs.
Okay.
It's a great resource.
Okay, and our title of the show, Medicare and You 2002. Okay, well, now what will we find in this book here?
Marcia, that has information on what traditional Medicare is. It has some information in there about Medicare Plus Choice, managed care. Now, this particular brochure is being mailed out, and many of our listeners have probably already received one. Every household is being sent one that has a Medicare beneficiary. But of course, you can certainly call our office, and we'll be more than happy to provide one. Or they can go out to the www.medicare.gov and also order any of these brochures that we're going to talk about.
Now that's good. Now, I don't know if our public knows or not, but we have Spanish-speaking
Brochures? Yes, Marcia.
Okay.
A lot of the information that we have is not only available in Spanish, but it's also available in large print. It's also available in Braille. And then we also have some audio tapes that we have available. So your listeners can call in and we can let them know what we have available for them.
Okay, so Medicare and other health benefits, your guide to who pays first. You can get all of these manuals in Spanish as well as in English. And like Fran said, you can get it on audio tape, Braille. Now that's a good way to cover everything and everybody.
Yes, and large print.
Okay,
We
large
also have
print.
many of ours.
Okay.
Not all of the pamphlets are available in Spanish. Most of them are. But if your viewers call us, we can certainly let them know which ones are.
That's wonderful. Okay. Medicare and home health care?
Yes.
Okay.
Home health care is a benefit under Medicare Part A. And so if a beneficiary needs someone to come to the home, generally under home health care, again, that's covered by United Government Services, there is some medical necessity. There's a limit on the number of visits. But all of that is explained in that brochure, Marcia, or they can call, again, United Government Services.
Okay. I know this has got to be a good book. Well, all of them are, but mostly people who are homebound and stuff want to know if they can get someone to come to their house. And now, when we say home health care, is it the like visiting nurses and things like that, or companionship, or chore providers? Is all that in here?
Yes, there are providers who are licensed and who participate then with the Medicare program that then go out into the patient's homes. So Visiting Nurses Association is certainly one of many organizations out there.
Okay, wonderful. And what every woman wants to know, women with Medicare. See, we even got our own book, ladies and gentlemen. That's what I like. Women have their own. Okay, so women with Medicare, correction?
Yes, and that's one of the new brochures, Marcia, and we're really excited because it focuses on healthcare issues for women. Issues such as mammograms, pap smears, the importance of flu shots. There's a lot of very valuable information in that brochure as well.
Okay. Well, these are some very good guides. And got one question for you. Briefly tell us, what is Healthcare Financing Administration?
Okay, the Healthcare Financing Administration is part of the federal government that oversees the Medicare program. Now, just recently, they have had a name changed, and they are now the Centers for Medicare and Medicaid Services, or CMS.
Okay. Okay, good. So we do know what those things are. Well, you know, Fran, I'm telling you, there's so much knowledge out here that I'm hoping that you will get some phone calls from our viewers to express that they appreciate you being here and giving us a little more insight on the Medicare program. You cleared up some questions for me, because really I think a lot of us just assume that they're either programs for persons who are of low income nature or programs for senior citizens, and it seems like it's just a crossover. If you need it, you need it. You know, and this is what you should be eligible for, and it's actually some, I shouldn't say owed to you, but it's actually something that's given to you because you do need it. You know, you actually do need these type of services, and we had an opportunity to meet Sarah Talley from the Social Security Administration, and she gave us a lot of informative information about when to apply, how to apply.
Oh, that's
and
great.
So this connects right along with the Social Security Administration, because everybody knows when you get a certain age or everything, you want to know, well, when do I apply for Medicare?
And that's great, Marcia. And let me just also point out, because we work very, very closely with the Social Security Administration, if your viewers have questions about how they become eligible for Medicare, they need to contact the Social Security Administration. Wisconsin Physician Services does not have any involvement in terms of helping people become eligible for Medicare.
Okay.
All of that is addressed through the Social Security Administration. If your viewers should need a new Medicare card, again, they can call the Social Security Administration. We do not issue Medicare cards.
Okay.
If their address changes, very important that they contact the Social Security Administration.
Okay, okay. So you guys actually are linked up directly with the Social Security Administration.
We work very, very closely with all of our Medicare partners. We work with Social Security Administration, with the Michigan Peer Review Organization, the Medicare Medicaid Assistance Program. Each entity has, outreach programs that they also, support, just like WPS does. Very often we will be at events that help represent all aspects of Medicare.
Okay. Okay. Well, Fran, I want to thank you for the information, because it's a lot. And basically this half hour may not have covered enough of that good wealth of information. So we do want to ask you to come back and join us again.
I'd be happy to, Marcia.
Okay, thank you. Well, ladies and gentlemen, we will post all of the phone numbers that Fran Plex spoke about, so please take a moment out and write those numbers down, and if not, you can give us a call here and we'll give that information to you, as well as the website addresses that she also mentioned. And as we usually tell you, that we're trying to better educate our public with information that we find is useful throughout the state of Michigan. So if you have any questions, if you have an idea or a show that you want to see, give us a call here at Just Ask, 248-988-0250, 248-988-0250. Well, you know who I am. I'm your host, Marcia Florence, but what do I always say? If you know someone with a disability, don't be afraid to ask. Just ask. I'm your host. Thank you.